Another question is, Dr. Morales, do I need a crescent thigh lift or a vertical thigh lift? And so, man, this is one of those surgeries that not a lot of surgeons do. I do, I think, quite a bit of them. I think I do probably the most in the practice. It is very commonly associated to massive weight loss where there's a significant deflation and there's subsequent skin excess. So where that skin excess is very, very, very important. We're talking about the thigh lift specifically. So when you have skin excess in the upper inner thigh and it's close enough to the mons area, then we can do a procedure called a crescent inner thigh lift. And then that scar is going to be placed well within the bikini line so you don't see it. And you're like, well, Dr. Brown, I don't see the scar. That's the point. I don't want to see the scar. It's in the bikini line. We don't want to see it. Typically, it's going to start right here, and then be a line that goes in, and it goes a little bit into the buttock crease. But we're able to restore and lift the contours of the upper inner thigh. And that's called a crescent thigh lift. Commonly do that with some liposuction. That way I can kind of streamline that upper inner thigh and get it to come up a little bit more. If you have a lot more skin, and you have skin excess from here to here, then you go to the next level. The next level of thigh lift surgery is called a vertical thigh lift. And so it incorporates a crescent thigh lift. So her incision resection started up here in the groin, and it goes past her mid-seam of her thighs, and it goes something like this. Okay? And that scar is going to be right along where you have a pant seam. So that scar is very important to understand that you're going to have it's going to be right on the inside, and it'll trend up into the groin area. Super powerful procedure because we're wrapping her thighs vertically all the way around, so you're able to reduce the cellulitic appearance of the anterior thigh and the posterior thigh because you wrap the skin tightly by removing skin in the middle. So these are just the requirements when you have significant excess skin of the entire thigh. So you will have that conversation with your surgeon when you're looking about doing something with your thighs and the skin laxity. Where is that skin laxity? What can you expect with the crescent inner thigh lift versus needing something a little bit more, which is called the vertical thigh lift? So great question. It is one of those procedures you want to make sure your surgeon does these, fairly frequently. They're going to be typically an add-on contouring surgery such as a tummy tuck or a body lift or a body makeover. It can be done safely, and it doesn't add that much more recovery time to your procedure time overall. So hope you learned something. Come back to my page for more frequently asked questions and learning more about plastic surgery. And don't forget, like and subscribe. See you at the next one.